can definitely say that we've seen more need for mental health resources. We've been advocating for, social workers, especially. My building has close to 2,000 students in our high school, and we have two social workers. It's not enough. And, we've constantly been saying the students are in need. We had COVID. After COVID, there was definitely an increase, but there is a need for more than we have currently, and I guess it ties into the funding that we just mentioned. What resources can be allocated to the students are definitely trying to, I guess, they're trying to hide behind the drugs and alcohol really has something to do with some other issue. It's not just that. And I think we need to figure out a way that we can supply schools. And I think I'm lucky my school has, psychologists as well as social workers. That's more than some other districts and schools have. But I think the overall problem is that if we don't address that, we're not going to see any increase in the educational levels. They want to compare us to other schools in other countries as to how well we're doing. We're not going to see that change unless we fix the mental health issues that are prevalent.
So that's such an important point. We've got this problem with our kids today that, when we were growing up, I'm older than most of you in this room, but in this bus. But when I was growing up, you had to worry about the other kids in school and the other people on your baseball team or the other people in the neighborhood. These kids are comparing themselves to every kid in the world every day on their phones, trying to live up to these impossible standards. Then you take, the COVID, and then you take the competition of today's world, and then you add in Farmingdale, where you had that awful bus tragedy and all those kids and the teachers died. I mean, that was terrible. So you have all this mental health stuff that you got to deal with. And Farmingdale's a pretty, straightforward, middle-class school district. Think of other school districts that are low-income school districts where the volume of problems is even higher. And let's say everybody had the same resources, which they don't, but let's say they did. 2 social workers in the school, or 1 school psychologist, maybe a guidance counselor, dealing with these kids, where in some school districts, 10% of the kids have problems, and they've got private health insurance, and they've got a good school district. And then you got other school districts where 50% of the kids have a problem. They don't have private health insurance, and they're dealing with all these problems on top of that. And it's like, no wonder kids end up in drug, alcohol, and mental health problems that have gone from being small problems to big problems.